osteoporosis is a calcium deficiency. The bones get brittle. Okay, the bones get brittle. Okay, if you have a vitamin D deficiency, the bones get like rubbery. Okay, the bones get rubbery. In adults, they call it osteomalacia. In little kids, they call it rickets. You very, very rarely see rickets in this country because the kids are going to the doctor. Okay, they go to a pediatrician and they check that. Okay, and they do blood tests. So if they have a vitamin D deficiency, they just give them a supplement. Okay, but some underdeveloped countries, they don't have a lot of vitamin D in the diet. Okay, so they can get rickets. And the kids walk, their legs are like this. They're walking, and it's not a knee problem. Both the bones are bent. Both the bones are bent. Okay? So my brother was in medical school, and he had come home one time, it was like Christmas or something, and he goes, hey, I got a film I want you to look at. Right, so he puts the film up, I go, frickin' guy got rickets? He goes, yeah. So I go, yeah, look how bent they are. Like, where the hell did this come from? It was in New Hampshire, and he grew up in the woods like a cabin with his family, and the kid never got health care. And he had a vitamin D deficiency. My brother goes, how do you fix that? Well, you don't. I said, yeah, you gotta break both legs. You know, I said, you're not gonna do that, you're an adult. All right, so minerals, and okay, so we'll go over how to hopefully fix this. So, you know, you see that calcium supplements are always fortified with vitamin D. You need vitamin D to absorb calcium, okay? And you're gonna do that in the ileum portion of your small intestine, okay? So once, especially women, okay, when you hit men don't hit menopause, but women, especially in menopause, anyone can be osteoporotic, okay? But especially women, once you hit menopause, for some reason you start sucking calcium out of your bones, okay? So you're diagnosed with osteoporosis, you already got it, okay? It's very hard to build it back, so she's trying to maintain it. So I'm telling all the ladies in the room right now, start training for menopause today. Okay, make sure you get a lot of stuff with calcium and vitamin D, okay? Right, so minerals, okay? Calcium, phosphorus, magnesium, iron, right? All in the bones. You need iron to make your red blood cells. So you need to make blood. Okay? Vitamin C, right, helps us synthesize collagen, okay? Same with vitamin K, it's a fat soluble vitamin. We absorb that in our large intestine. And we're gonna make protein plus vitamin A. Okay. When you're pregnant, when you're taking your prenatal vitamins, they will give you vitamin A. They're going to give you the beta-carotene form of vitamin A, not the retinal form, because that can be toxic to the fetus. Okay, but it's not. Okay. No, the retinal portion of vitamin A. There's two ways you can get vitamin A. Beta-carotene, okay, you get that from green leafy vegetables, okay? One is a retinal form, okay? If you're pregnant, you don't want to take the retinal form, okay? Older's fine, because people usually take that if they have a problem with the retinal. Okay? So growth hormone, okay, it makes us grow, comes from the anterior pituitary gland. Same with insulin-like growth factors, okay? So type 1 diabetics, before they had insulin and stuff, how they treated type 1 diabetes is they starved the kids. They didn't feed them. Because if you feed them too much glucose, that would affect them. So basically, instead of kids dying right away, it took a long time. It was almost like torture. The kids were very, very frail, and they were always very short in stature because of this. So now they let the kids basically eat whatever they want, okay, which should be healthy, okay? But as long as you give them insulin, they're fine, okay? And they watch the height levels, and they do growth tests and stuff on it. They think they're below that little line there. Okay, and thyroid hormones. Okay, your thyroid gland, okay, secretes T3, which is triiodothyronine, and T4 is thyroxine, and also calcitriol. Okay, it's going to put calcium in the bones. Okay, this here is the, sorry. Right, so we're looking for an adjunct. So this is the osteoporotic bone. So look at all the holes in here. This is very, very brittle bone. Okay, that's not happy, that bone. That's not happy. Okay? All right, so we'll go over this a little bit again. So a lot of times you hear like, you see, grandma and grandpa fell down the stairs, they broke their head. You talk to grandma or grandpa, they're walking down the stairs, and just the weight they're putting on the femur, it'll snap. and then that's what makes them fall down the stairs. So like my grandfather, my wife's father, they go, no, I was walking down the stairs, the thing broke, and that's why I fell. Okay, so I said, okay? All right, let's go over some fractures here, and I'll show you films. Okay, so no knees, okay, there's two types of fractures, okay? There's a non-displaced or displaced fracture, okay? So a fracture is a break in any bone. I love when people say, I didn't break my arm, I fractured it. It's the same friggin' thing. It's just different types of fractures, okay? Different types of breaks, okay? So if you break a bone and it's still in alignment, okay, that is a non-displaced fracture. That's a non-displaced fracture, okay? If you break it and it moves, that's a displaced fracture. Yeah, so if you break it and it's still in alignment, the two ends, okay, that's non-displaced. If you break it and it moves, it's displaced. Now you gotta set it, gotta reset it. Okay, now we can do it. So, shut this thing. Huh? I just turn it off. It says remind me to turn the freaking thing back on. All right, so, okay, so if you break, thanks. If you break a bone, okay, and it stays within the confines of the soft tissue, that's called a simple or closed fracture. Simple or closed. If you break it and it displaces and sticks out the soft tissue, that's called an open or compound fracture. A lot more dangerous, okay? Because if you're gonna break a bone and you're gonna displace it and it sticks out the skin, okay, that's some heavy duty trauma. Any kind of trauma, what usually is involved? Dirt, dirty stuff, right? So now you just open your body to the external environment. So you're up to get an infection. Okay, so that's kind of, you gotta watch that. Okay. Comminuted fracture, you break in multiple places, right? You break it in multiple places. Okay, a green stick fracture is in little kids, okay? In little kids. So you ever try to break a branch off a tree that's not dead? Can you break it in half? No, right? If the tree is dried out, boom, it'll crack right in half, okay? So remember, the ossification centers aren't all bones, so the little kids are still rubbery. Do you ever see a little kid like fall, bang, they'll roll and get right up and they run? If I felt like that, I'd be in traction, right? All right? So what happens here is you follow the periosteum of the bone. You follow that little periosteum. Okay? A lot of times you can't see this break. So like a little kid will go to emergency room, they'll take an x-ray and they say, listen, ice it down, come back in a couple days. We'll reshoot the film. Because it's so much swelling, you can't even see the break. And a lot of times what they'll do is they'll treat it like it's a break. So they'll put a soft cast on or something and they'll immobilize it. Then the kids will come back. Within a week or two, they'll get like what they call bony fracture, but you know it's fracture. Okay, it's here. Okay. This here's an impacted fracture. This is like if you jump off something high, you land on both feet, the femurs will go right in. This here, these are common when nobody wore seatbelts, no airbags. Front impact collision in a car, all right away you put your arms out, try to stop yourself, you hit the dashboard, everything will break. Okay. A Potts fracture, this commonly happens in the spring, right, late spring, right? The weather gets good, and you walk around, and you're walking your little foo-foo dog, and you're wearing little stupid flippy-floppy shoes, and you roll off the curb. Okay. So this one here, you're breaking your lateral. If you roll it inside, you're breaking your lateral malleolus, okay, and you're tearing your tibio-talar ligament. If you do it the opposite way, okay, you'll be breaking your medial malleolus and tearing the fibular-talar ligament. Okay, either way, they're going to pin it, and you're going to be in a cast for the rest of the summer. Okay. A Colles fracture. Okay, this here, when like you fall off a bike or a skateboard or trip, what do? You put your arm out. Okay, boom, it snaps. Okay, so it's the distal radius snaps. So what you do is, right, when you come up, and you usually see a little kids that come walking in, and so you have a joint here, and a joint here, you have another joint. This will be displaced like that. Okay, so an arm that usually breaks like that. So I remember you pet the Colles with the Colles fracture. You pet the Colles go. Okay, all right, there's a couple other types of fractures, okay? So, if you break your second and third flange, right, so your index finger and your middle finger, Okay, if you break those two fingers, they call that a boxer's fracture. Okay, if you break your fourth and fifth phalange, they call that a barroom fracture. Okay, they call this a boxer's fracture because when a boxer punches, they're very precise. A drunk just slips. That's where that came from. Okay, so there's another one. It's called the bedroom fracture. Okay, so okay, don't laugh. I'm making a foot. 1, 2, 3, 4, 5. Okay, so when you get up at night, you walk into the bathroom or whatever, and you walk and you go, and you hit the side of the bed. You look at your toe, and it looks like this. It looks like that. Your brain. That's called a bedroom fracture. It's called a bedroom fracture. We'll get into a hangman's fracture. So I have my practice. I have work on Saturday in the clinic. You know, I'm always in a suit when you're seeing patients. So I'm supposed to go down to Long Beach Island, meet the college friends, and so I'm working in the morning. So I drive down there, and it's like 99 degrees and incredibly good. So my buddy lived, they had this big long driveway, and a lot of people mistook for a parking lot. So everybody parks the cars in. So I pulled in, and I knocked on the door, and someone was there, and I thought that they were getting served with papers again because he was always getting in trouble with noise. So I'm in a suit, they thought I was an attorney. So I go, no, I'm Tom Betsy. And I go, well, where's everybody? You know, so they played football on the beach. So I said, grab my bag, I'm about to go to change. And a bunch of guys come running. So he was on a bag, and they were on the ocean area, so across the street. So guys come running across the street, and they go, Big Joe fell on Little Joe. And Little Joe hurt his foot. So Big Joe lost a lot of weight. This is Corbo, right? Corbo, okay. So Corbo was 400 pounds at one time, okay? And he fell on his little cousin. So that was Big Joe and Little Joe. So the guys come across the street, and I gotta go out, right? And I see Big Joe carrying Little Joe, and Big Joe's crying because he hurt Little Joe. Okay? So you look at Little Joe's foot, and that's what it looked like. So yeah, okay, you got a bedroom fracture. So we gotta go get this checked. So we go to the hospital. Now, again, so I'm still in the suit. It is like 99 degrees, and I'm sweating like you can't believe. But we're just like, get a car, let's throw him in my car. So if you get to the hospital, they take the film, and they just wrap it. They go, okay, so then go see his regular doctor Monday. All right, they give him crutches. So we get back to the place, they go, can you tell where it's broke? I go, you can tell where it's broke. So I think it was all displaced like that. So they popped it back in, they wrapped it up, they gave him crutches, and they gave him something for the pain, but he had liquid. We have a liquid stuff for the pain, so we took the whole bar. So, yeah, that was it. And Little Joe was okay. All right, so I'm gonna shut the lights on so we can see. Okay, these pictures do not match up with with some of the pictures here. Okay, all right, so this is a normal hard tissue radiograph called an X-ray. Okay, so this one here. This here is a displaced fracture you can see right now. Now, it's a two-dimensional object which is trying to show three-dimensional, so you got a lot of superimposition. You can't see where it's coming out of the arm here because of soft tissues. So they would do opposing views. So this side, you got to do this side. Okay? So when you break something, they're going to move you around. It's going to hurt, but you got to see where it breaks. Okay? So but you would know that this is fractured and sticking out because they're going to be walking in. Bones will be sticking out. Bones will be sticking out. So when I was an EMT up at my college, Franklin Pierce was the only college, back then, the only college that had its own student-run fire department and EMT squad. They had an old 1955 Ford fire truck. It was white, it had no roof on it. So they had no roofs in those days. Our EMT vehicle was a hearse that was painted blue and had just a magnet light on it. That's what we had. So the old ambulances were hearse. They were hearse, they painted them white, put a light on it. So if somebody was injured, they drove as fast as they could to the injury, pick the person up, throw them in, and go as fast as you can to the hospital. They don't do it anymore. EMTs go and they stabilize the person. If the person's not breathing or anything, paramedics go out. Okay, they stabilize the person on scene, then they go to the hospital. Okay, but we did with what we had in those days. Okay, so I was on call one weekend, and a kid fell out the window. So they had these old Anderson crank windows that you crank and they open up like that and come back. Well, if you broke the crank, you could push the window out, pull it back in. So these two drunk guys, they were swinging out of the window, coming back in, jumping and going, Superman, comes through the window. Well, the window went out, it came back, and the kid went down. So thank God it was New Hampshire, it friggin' rains all the time, and snowing in the winter and spring. They kind of landed in mud. But when he hit, he broke his arm. Okay, so I was the first one on scene, and I go, all right, dude, just calm down, relax, we gotta get a sea collar on. So he's going, dude, just push it back in. Dude, I'll buy you beer. You want me to push your bone back? So we were taking bets on what his blood alcohol levels were, because he should have passed out. It's okay. So we got him wrapped up. Range Rescue came over, that was the town rescue. So we took him to Fitchburg Hospital over in Massachusetts, because on the line. So we took him there. He was actually from New Hampshire, so his father could drive to the hospital there. We got to the hospital, he said, what happened? He said, well, he fell out of, he was a little intoxicated, he fell out of the window. His father started beating shit out of him. I'm from Chicago. The cops had to pull the father off the kid, this and that. A week later, or 2 weeks later, the kid was smoking pot, he looks out the window, he falls out the window, there's a flip, he broke ribs, but he was okay too. Yeah. So we called it the Franklin Pierce College diving team, that's what we called it. Yeah. All right, so, okay, this here, okay, this is where the break is, it should be down here, okay? So this isn't right, okay? So the break is up in the shoulder joint. And you can't break a joint. You say broke my knee, you don't break it, okay? You don't break a joint. What you do is you break the bones that put the joint together, okay? So it's usually a fracture dislocation if it's that close to the joint. So if the trauma is enough to break the bone, what are you doing to that soft tissue? You're probably tearing it. So you're gonna get a sprain, strain, injury, or just a full avulsion or tear. Okay, so right here, okay, so if you look in here, right, the shoulder's a ball and socket joint. There's a socket. The head of the humerus, right, is the ball. So it looks like this. It's ball and socket joint. You guys can see that, right? Okay. So that's where that is. What happened here is, right here, he fractured this, right here. This person fractured that, right? So the ball that's supposed to be here is down here. This here is the glenoid cavity. That's the cup, right? That's the socket. This is the head. He broke it and the whole ball fell this way. That's got to be re-put up and they would pin that. Okay, they would pin that. They put a plate, okay, on that. Okay, that fracture. And patient of mine, he was one of the deputy chiefs in Clifton. He was a patient and he had bought a new house. He was on a ladder. The ladder slipped. He hit the gas pipe and it flipped him. And he landed on his shoulder. Both his kids were Boy Scouts. They put a sling and swat on him. So you put a sling and the swat ties in like that, so you don't move it. Went to the hospital. Hospital sent him home. They said, listen, you probably just strained. You go see your doctor the next day or whatever. So he calls me, this dude, I'm in a lot of pain. Can I show you your feels? He came over. This is what he had. They misread the X-ray. I said, no, you got to go back like right friggin' now. And they operated on him that day. We're gonna send him home. And he came from the hospital. I gotta go see you. He said, yeah, I've been. I go, no, the kids did a great job wrapping him up. I ain't take it off. I don't need to unwrap it. See from the film, you really effed yourself up. You gotta go back. And he got surgery that day. Went back, went in, and that was that. This is impacted with, so again, the picture's here, but that's what that's showing. Okay, what happened, the fracture's right up here. So what happened was the person hit it, and the humerus just broke right on itself, and it split the greater tubercle, and that's where a crack is. So this here should be all one piece, to snap this one. So this up here, that should be up there, okay? All right? They're pretty easy fractures to see. This is a green stick, see it break right in half? This is actually, you can see it's pretty easy, and it's a little displaced. Okay, so it's right here. So before we had digital films, you could blow it up, okay? You could change the contrast on it so you could see. When we just had X-rays, what we would do is we call it a hot lamp, okay? It's basically a light bulb in a little square box. And you took just a film, X-ray film, you roll it up, and you look right into the light, and you follow the periosteum. You follow the periosteum of the bone. See, it's all nice. Look at this. Not nice, not nice. And you'd see like that little shadow. That would be the fraction. Okay, so all the doctors, we have to wear glasses because we screwed up our eyes. We're looking for fractures, you know? Right, again, this isn't right. This is where the break is. So the break is right here on this. This stuff is be right here. Okay, but they tear. You can see that the ligaments got in here. You can see the torn right here, and that's a splashed fracture. You can see that pretty easy. And genitalis fracture. So right here, if you follow the periosteum, right? See how it leaves? So that should be right attached. And that should be attached. So right there, that don't look right. So that's a fracture. Okay? All right. And here, you're gonna be holding your arm stuff too. All right? Okay, so how do we repair? You good with the lights off in the back, or should I turn them on?
Yes.
Everybody good?
Yeah, I'm good.
No one's falling asleep? You sure? Wake up. Okay, so when you break something, right, because remember, you're tearing blood vessels, okay? So you gotta get a hematoma, okay? So you gotta clot the blood. So you get what they call a fractured hematoma. Then you're gonna get osteoblasts in the area and fibroblasts, okay? So you're gonna lay down new soft tissue, like cartilaginous tissue. That's gonna be called a soft callus or fibrocartilaginous callus, okay? Okay, because you're making fibrocartilage, okay? Then you're gonna maintain, then that cartilage is gonna turn to bone, okay? And you're gonna get a bony or hard callus. And you can actually palpate that, okay? And then of course, you know, within the year, you get bone remodeling, it's gonna chew that up, okay? So you can see that on an x-ray. So you break the bone, right? Breaking the blood vessels in there. So you gotta stop that blood, so you're gonna clot the blood, okay? Look at these big cells you're getting in there, okay? These are fibroblasts. So big white blood cells are gonna chew up, an osteoclast is gonna chew up the jagged bone, reabsorb it. Any other cellular debris, you're gonna reabsorb. With the phagocytes and white blood cells, okay? And then you're gonna start laying down fibers, okay? So here, you're gonna get like, look at this, big happy cells, cartilage cells, okay? Then it's gonna change the bone. Then osteoblast is gonna change the bone, and then you're gonna do some bone remodeling. So, but my daughter being a cheerleader, she broke her collarbone twice, okay? And because she was so small, when she fell on her arm, her clavicle just went like this. It bent, it came back, okay? So on an x-ray, okay, it was very hard to see, okay, a little kid. So what we did was we immobilized her, okay? We treated it like it was a fracture. And within a week, she's like, Dad, I feel a bump. And she did break it, and that was the bony callus. That was the bony callus. Okay? And we just let it go, it healed properly. And we just let it go there, okay? I'll tell you something else too. Oh, and so, I was seeing people getting abused and stuff. So when we lived in Georgia, when I was a resident there, my wife was a teacher, and her teacher's aide hurt her back. And so she goes, well, you know, my husband's resident there. It doesn't cost a lot, you know, to go to the clinic there. So she came in, and we shot films, of course. And when you're doing a mid-back, the ribs get in there. And she had all these bony calluses on her ribs. Like, this isn't right. So I called one of the attendants, called one of the docs. I go, come here, I want you to look at this. And I'll never forget what he said. When he saw it, he goes, somebody's beating the shit out of her. That's exactly what he said. And so we got her. She, it's in Georgia, and they were in a little rural area, which really doesn't make any difference. But her mother and father had her very, very young. They were young in age. And the father was an alcoholic, and he abused the mother and her. Then she got out of the house. She was very young. She got married. Her husband was a drunk and beat the shit out of her. So we got her help. We got her counseling, and we got her in a safe environment. But it was the bony calluses. She had multiple rib fractures and never got fixed. She was afraid. And you would never, ever know it leaving. You never know. She looked like a normal person, drove a nice car, dressed nice, everything. You would never know. So you find out a lot of different things when you treat patients. So you're not treating just the back pain, you're treating the whole patient. You're not treating the broken arm, you're treating the whole patient. Okay? I think we're losing that in hospitals now. They're running them like corporations. Okay? Hackensack goes like most of New Jersey. Meridian's all over the place. And if they don't do it, Valley Hospital has it. You know, remember, administrators are not doctors. They look at spreadsheets all day long, and what we made this month has to be more money than last month. That's all it is. It's a shame. All right, so if you break a fracture, okay, if you break a fracture, if you have a fracture, you're trying to heal it, okay, you're gonna have to realign it. So if it's broken, it's like that, right? You're gonna close it, close reduction. Okay, if it's broke like that, you gotta open reduction, you gotta set. Okay, you gotta set. Okay. All right, so bones roll in homeostasis or calcium. Okay, so 99% of our calcium is gonna be in bone. Okay. In blood plasma, we have between 9 and 11 milligrams per 100 mils of blood. Okay, so remember, we need calcium for electrical impulses and muscle contractions. And we'll see that when we do muscle physiology. Okay, and when I do muscle physiology, I go over a motor neuron, I go over the parts, okay, and I also go over the neurotransmitters that get secreted. Okay, so you'll know all that for next semester. Okay, so we put calcium right in the bone, right, or when we don't have enough calcium in the blood, the osteoclast will break down the bone. Okay, they'll break down the bone and put it back in the blood. If we have too much calcium in the blood, right, we got to store it. Okay, so I can store it in the bone. Okay, this is controlled by calcitriol and parathyroid hormone. You have a thyroid gland that's right under your larynx. Posterior to the thyroid gland, you got 4 little glands. Those are parathyroid glands. Okay, they're parathyroid glands. Okay. Okay. This I pulled from the endocrine chapter, so it may not be. If you have a textbook, it's probably not going to be there. Okay, but if I have high levels of calcium, okay, if I have high levels of calcium in my blood, I get a bunch of calcium. Okay, what's going to happen is my thyroid gland is going to release calcitonin. Calcitonin. So what calcitonin does is, okay, it's going to take the calcium from my blood and stick it in the bone. So it's going to stop osteoclastic activity. Okay. But now I need some calcium in my blood because I want to contract my muscles. I want to have an electrical impulse. So I have specialized cells called chief cells in my parathyroid gland, and they're going to secrete parathyroid hormone. Okay. Parathyroid hormone is going to make our osteoclasts break down the bone. Okay. And also, it's going to release calcitriol. Calcitriol is normally stored in the kidneys. Okay, calcitriol is vitamin D. Vitamin D is actually a hormone. And what vitamin D is going to do is it's going to allow me to absorb calcium in my intestines. It's the lumen portion. It's the ileum portion of the intestines. Okay, all right. So see these little green things. These are the parathyroid gland. So now, I just saw a cool operation, and a friend of mine, she got it done, and she sent me the tape. The people that were doing it were in Florida. She was getting out of that. They found the person had a node on their thyroid gland, and it was a parathyroid gland, and they had parathyroid cancer. Okay, so what they did was they anesthetized them. They put a little cut in the neck, and they move everything over.